We're ready.
Okay. Good afternoon, everyone. This is Cheryl Welbeck at Directors of Health Promotion. We also have Nicolette Warren from SOFI on the line. Welcome to today's Ask the Expert Hours session, which is on increasing access to healthy foods through healthy corner stores. And our guests today, our guest experts are from the Food Trust. We have on the line with us Karen Shore, who is the Director of Consulting for the Food Trust. Karen has 19 years of experience in the intersection between food management and public health, and she leads an 11-person consulting team for the Food Trust and is responsible for design, implementation, financial management, staff, and team management, and strategic direction for projects throughout the United States. Karen, let's see, has a Master of National Implementation, I'm sorry. Karen holds a Master's in Public Health from Johns Hopkins, where she was aligned with the school's Center for a Livable Future and received a bachelor's from Smith College, and she is based in Philadelphia. Our second expert on the line is Juan Vila, who is the project manager for Food Trust. Juan is an expert in healthy corner store program design and implementation and brings to bear nearly 4 years of on-the-ground experience in Philadelphia's Healthy Corner Store Initiative, as well as expertise in best practices from his work nationally consulting on corner store projects. Juan is based in the San Francisco Bay Area and has been with Food Trust since 2013, supporting Food Trust corner store consulting projects throughout the country, and has been supporting healthy corner store initiatives in San Jose for nearly 2 years. So Karen and Juan, welcome back to the National Implementation and Dissemination for Chronic Disease Prevention Activities. Thank you for joining us again. Some of you were able to participate on the July 1 webinar that we had with Karen and Juan a while ago. If you were not able to participate in the July 1 webinar, that's okay, but we do have the line open for anyone who wants to ask any follow-up questions to the July 1 webinar, or if you have any new questions or any questions related to your specific project. Today would be a great opportunity to ask our resident experts any questions that you have about increasing access to healthy foods through Healthy Corner Store initiatives. So Karen and Juan, welcome to today's call.
Thank you so much. It's nice to be here again.
Yeah, thank you very much.
Okay, so we've got a number of people on the line. For anyone who is on the line, there is an option where you can raise your hand, in which case we're happy to unmute your line, or if you would prefer, you can also use the chat box located in the control panel if you're logged on using your computer. And there you can type your question if you wish, and we can direct that to Karen and Juan for them to address and provide examples or some best practices. So the line is open, and we'd like to open the floor to anyone who has questions about increasing access to healthy foods. So anyone who has questions for Karen and Juan, the line is open now for you to go ahead and ask questions. The little hand icon is how you would raise your hand if you need us to unmute your line.
So I know that I know in your initial presentation you went over a number of things about strategies for healthy cornerstones, and so I thought if you could just kind of summarize for our listeners some of the key points that you talked about initially, and then that might help spark some memories. And we do have a question, so if you could just do a summary, then it looks like Katie has a question, and we'll move to her.
Sure. So I'll get started, and Juan definitely fill in, where needed. But essentially, the general way to get started with an initiative is to this sounds simple, I understand that, and I also understand that it's really not, but the way to get started is to determine what the need is, and that's a combination of really understanding the communities, in the target region and where the low food access areas are. But going beyond that, really looking to see where the, types of stores are that you're interested in working in vis-a-vis things like transportation or bus routes or schools, places of business, and so on. And then I think there's a piece as well that is really important, which is the extent that, it's feasible, really getting a very good understanding of two very important things. One is what the community is looking for and what they need and what they want. And the second, sort of bucket of that type of information is what the store owners are willing to support or might be willing to support. So all of that goes into helping to determine what the intervention is. Saying there's going to be a Healthy Corner Store initiative really doesn't provide enough information to kind of get at, what the nature of the intervention might be. For example, what type of stores, where would these stores be located? What type of community engagement are people looking for? How important is WIC, for example, in the community? In terms of looking at WIC enrollment, or looking at the possibility that some of the stores might be WIC stores or might be WIC stores in the future, for example. And thinking about what other types of, once some changes are made to the healthy food and beverage environment, are there other ways that the store is being looked at to help promote a culture of health in the community? For example, looking at healthy store certification programs that might weave in, anti-tobacco, initiatives, or might include physical activity initiatives, particularly looking at community clinical linkages and other ways that this store that is now doing a better and better job over time of really supporting a healthy environment and making health the focal point of the store might be able to link with local hospitals or local clinics and provide additional access points for residents in need. So, those are just some ideas in thinking about what is the longer-term vision for this work. We always also recommend thinking about who it is that's going to be doing this work. Healthy retail programs in small stores, whether they be stores in pueblos or rural communities or frontier communities or, major urban centers, suburban, ex-urban areas, it's a lot of labor. It's a lot of labor to start that work, to go in and out of the stores and really help them. So our recommendation is really to think about, who is going to really be doing this work or who should be. And that often takes a look at, obviously looking at, what the available funding is and who the organization is that will be leading it, but also looking at community partners and other stakeholders that might help support the initiative. And then, there's designing the initiative, launching it, and getting it going. Evaluation, of course, is a key point there and really needs to be thought of very explicitly at the outset, so really designing the initiative to get at the overall goals that you will then be evaluating. And thinking always about the long-term sustainability of the initiative and what the business needs of the community are, so that it is ultimately, not just a public health initiative, but something that's also really good for businesses.
Karen, thanks for that overview. One of the things that you'd mentioned was, I guess as a starting point, was kind of determining the needs of the community, and then also kind of getting a sense for what the store owners would be able to provide or support in terms of the community needs. For many of the subrecipients on the line, I think an important step for their community projects is building a coalition of other stakeholders to work with. Who would you recommend for inclusion as community partners, typically, in a general sense?
Sure. So that's a really great question. We get asked that question a lot, and it does vary a bit from one community or from one region to another. But here's some examples of typical stakeholders that we really like to see involved in healthy retail initiatives. So first is public health, of course, right? So local health departments, state health departments if it's a statewide initiative, obviously, or their, I'm not sure what the right word is, maybe, kind of affiliates or ombudsmen. Different states have local health departments implemented differently. So, for example, in Maine, you have Healthy Maine Partnerships. In Pennsylvania, there's regional primary contractors that kind of oversee work in a region. And so, but involving the public health sector, we often have wonderful partners in academia and, not just, yes, certainly from evaluation partners. I mean, of course, that's, kind of the obvious way to involve, those partners, but also just graduate students, and we get wonderful support with data and mapping and, kind of some of the initial, even business planning support. Speaking of business planning, you want to make sure, again, that because you're doing a healthy retail initiative, that you have capacity to support business planning and that you have capacity to, or have included business perspectives. So we usually recommend including, for example, a convenience store association or a grocers association, either nationally, but, nationally as well as potentially, in the state, if there's a local grocers association or a state convenience store association, for example. The store owners themselves, particularly if sometimes you have a situation where, one store owner owns a couple of stores in a community, and that person, can usually be a great person to have on board. Chambers of commerce and small business associations, and then depending on, often like local, like sort of the financial sector, so CDFIs or community development corporations that would have financing dollars as well as business planning savvy available to help a store really plan for infrastructure improvements or exterior improvements, depending on the degree to which that were part of your initiative. And, really we find very important to have, local nonprofits or community organizations that are involved in this sort of work. And so for example, if you have a project that's including, local food, community gardens or, organizations that have a real focus on supporting a healthy local or regional food system are often involved. Depending on the community places of worship or recreation centers. For example, the YMCA has been a wonderful partner of ours just in general, but also in a few different initiatives. And I'm not just saying this because I'm on this call, more and more we're really looking to WIC as a wonderful partner. The last couple of years, we've partnered kind of very intentionally with WIC to look at ways to better support the stores that are already WIC stores. So how to support them, for example, in supporting the new WIC package, how to help those stores that are already WIC stores do a better job of supporting healthy food and beverage access to WIC moms, and just do a better job of supporting WIC moms in general. So looking at things like, targeting the WIC stores for nutrition education and taste tests. And, we do sort of free giveaways that was for those of you who are on the call, I went through kind of the series of nutrition education lessons we do in the stores that have a free giveaway that supports home cooking. So whether it's, a set of measuring spoons or measuring cups, what have you. But normally, particularly for a larger initiative, really like to get WIC involved and at least have them at the table. I think those are really kind of top of mind. I think also maybe, folks from distribution and producers, to the extent that local food will be involved, and distributors, really, really important because distribution is often one of the key challenges. I'm not sure, Juan, if there's any other folks you can think of. I know I kind of gave a laundry list, but those are kind of some of the typical folks we bring to the table.
You covered it pretty well, Karen. You know, I think that, yeah, all of those are really great partners whenever you're implementing a project, and yeah, I can't really think of many more.
Okay.
Okay, thanks, Karen and Juan. This is Cheryl with a question to Nicolette. It looks like someone may have a question on the line. Is there any way to unmute that person's line to see if they can direct their question to Karen and Juan?
Yes, I can definitely do that.
Okay.
I just need to identify who the person is. So just give me one second. Did they say who had the? I don't see a question, but I will. Just give me one second.
Okay.
Katie,
okay, so
Katie, do you have a question?
Hello?
Hi, Katie. Do you have a question for our presenters?
I did not. No, I'm sorry. I was confused at the start of the webinar if our lines were muted or not. But no, I am just kind of listening in for some extra information.
Okay, just a second. Thank you so much.
Great, thank you.
Okay, thanks. Okay, so we're waiting to see if any of the other callers on the line or participants have any questions. Karen, you also mentioned including hospitals and clinics and tying in some of the Healthy Corner Store initiatives with community and clinical linkages, which I think is important for some of the folks on the line who have selected that as a focus area for their projects, in addition to increasing access to healthy foods. Can you talk a little bit about how the community and clinical linkages piece ties in with the interventions that people have selected for increasing access to healthy foods?
Sure, I'd be happy to. You know, I think maybe before talking about the nuts and bolts of it, I'll kind of talk about the context a little bit. You know, I spoke about this on the webinar, so I don't want to go into a lot more detail, but I think it might be helpful just to think about, you know, how new this is. And this is something that, you know, I think it feels new for all of us. You know, everyone on the phone, it's not like there's a, time-tested way for the last 10 years that's really clear of doing this. And those of us who are doing this work are really learning as we're going and piloting new things, new ways for different sectors to really integrate and work together. So, you know, we definitely have some lessons learned there here at the Food Trust. We've been piloting this work for a couple of years now, but really at a high level, see it as a way to support the health and well-being of marginalized residents in, you know, people who at risk, and really in many ways take direct aim at health disparities and help to promote equity in these communities. So in other words, instead of, here's what sort of started to happen to us. So we've had a corner store initiative in Philadelphia for 8 years, which somehow makes it the oldest program in the country. I'm not sure how, it's not even double-digit years yet. But so, you know, this still feels very new and innovative to us just to do corner store work, to be honest with you. But I guess, you know, the way things move quickly, you know, we're always, you know, kind of modifying and implementing and innovating, and we all are looking to do more with the great programs that we have on the ground. And that's really the genesis of our work with hospitals and clinics, was really just having some of these stores that have been in the program for, you know, a couple of years, and you really see the before and after in some of these stores, and it's really quite striking. And the store, it just, you notice that, boy, not only has the store made a lot of additions to the, number of healthy foods and beverages added. But just you walk into the store and it's got a different feel now, and you sort of feel like health is more a focal point of the store, I guess, as we say. And we also realize that these stores, many of them for a long time, but then certainly those that have been in the program for a little longer and have been, doing some of these, major changes, sort of full conversion stores, you realize that the stores either have long been a real trusted resource in communities, or due to the nature of the fact that they've been participating in this program and really, trying to, better the health of residents while obviously making good sense for business, that the stores have really become community hubs, or they've long been community hubs, long been places that are trusted and respected resources in the community. And the thinking, that we had was really that maybe it would be possible to do even more and to leverage these really amazing resources now to help think more broadly, but also more deeply about what might be possible, in terms of looking at health disparities, taking aim at health disparities in these communities. And so we've done a couple of different things trying to do that. And one of them is some of the local hospitals in the Philadelphia area, have really been wonderful partners. For example, funding a farmer's market, providing resources to, set up a farmer's market and to, pay for, all of the labor and, EBT fees and all of that go into running a farmer's market successfully, and the marketing materials and so on. We have some hospitals that have funded some Philly food bucks. Those are, fruit and vegetable incentive program, where they have provided some funding for a portion of the food bucks, or food bucks that are then distributed, kind of in that hospital's area. And even I think that in and of itself represents community clinical linkages, because it's, a hospital really doing something to support food access. But we started, we developed relationships and began to talk about what could we do to really bring these together. And we got funding to do a small pilot. I think it was maybe in, I don't know if you remember, Juan, was it like 6 stores or 10 stores, to do the Heart Smarts pilot. And was that about right?
Yeah.
Yeah, I think so. Okay. And the pilot was to create, again, it was called Heart Smarts, and it was to go into some of these high-performing stores, as I mentioned, and do, with the health professionals from the hospital, which is important, and do blood pressure screening, heart health information, cooking heart healthy, low sodium and heart healthy recipes, cooking demos, taste tests, and things like that, as on a regular basis. And one of the things that was happening on a regular basis was these blood pressure screenings that were done in the corner stores. And we also did them at, I think it was it may have been 2 farmers markets. And we had some really fundamental questions. When you start doing something like this, you don't know, is anyone going to come? Who is going to get their blood pressure taken in a corner store? Or, is there even room to do this? Are we going to just, people are going to walk in and, walk into the table, and are we going to disrupt business? You have like these basic fundamental questions, about if it's even feasible to do, if it's too much for the hospital to do, kind of whether you really, feel like you're able to maintain patient confidentiality, and, think about, what if someone's blood pressure is high? You have to think about referring people, to into the healthcare system. And there's all of this, additional work that needs to be thought through and thought about, and the hospital partners were certainly the ideal people to do that with us. But what we found was that not only were people, and we also did, not as part of the HeartSmarts pilot, but we did BMI screening. So that's even more, who's going to step on a scale in front of their friends, you know, at the corner store? But miraculously, people did. And what we found was not only were, you know, these pilots successful, but you know, it's still early, no question about it. It's still, you know, not enough of a sample size to publish on. We wouldn't get published anywhere yet because it's not a big enough sample. But the results are so promising and so encouraging and really showed, you know, we basically all kind of sat back and from looking at the initial pilot results and went, oh my goodness, you know, I think we may have just, you know, hit the nail on the head. Whatever this synergy is, whatever it's done to the environment in the store, it's created, you know, we've got these cohorts now of people that come back every week to get their blood pressure checked. We weren't expecting that at all. We weren't expecting to, you know, have one of the populations that we really effectively reached were African-American men, a population that is, you know, not easy to sort of get into the healthcare system in a traditional way for preventive screenings and so on. So we sort of felt like we've really got something here, let's continue it, and we've just gotten funding to expand the pilot, which we're really excited about, and really take a closer look at and really do some other things with community clinical linkages. So in terms of the what, like what is possible, I can tell you about what we're doing now, and then I can tell you about some other, you know, ideas. And I'll please understand that all of this is really new. I think everyone on the phone understands that, actually. But here are some things that are being piloted that I'm aware of. One is this HeartSmarts idea. So that's, I guess there's two basic buckets, right? There's ideas of having the healthcare system come into the community, whether that's at a farmer's market or in a retail setting. And then there's this idea of doing something differently in the hospital. And that's, at least to my brain, how I think about it. I think about, you know, community clinical linkages, meaning, you know, the hospital, you know, taking advantage of the ability to use these stores to reach more people where they are in their community. But then there's also this piece of how do you bring this work into the hospital. So I'm going to talk about both of those separately. And I should also say, when I say hospital, I mean hospital or clinic. So one is bringing these services into the community and reaching more people. Well, there's the HeartSmarts pilot. There's doing things like behavioral health, you know, whether it's behavioral health or smoking cessation or, you know, screenings, various types of screenings that can happen, coordinating where, you know, some hospital systems, for example, have like a mobile clinic, and creating times every week that truck, you know, or bus usually, kind of pulls up out front. And whether it's doing vaccinations or whether it's doing blood pressure screenings or mobile mammography or, you know, whatever it may be, it's, you know, whatever the, you know, funding and interest is to do, it's, you know, a regular part and a scheduled part of the Healthy Corner Store Initiative or Rural Grocery Store Initiative. So there's kind of doing these screenings and disease screenings and health education and information. And then there's this nutrition education piece, which kind of links the two, right? So it's how to cook heart healthy, you know, diabetes, you know, recipes, you know, for diabetics. There's, you know, something that I'm actually really interested in that we haven't gotten a chance to do yet, but I figure that's a really good time to bring it up on this call to give you folks who are starting these initiatives this good idea. Maybe you can make it work. I think it would be really amazing to tie in, you know, kind of mother-baby or you know, pregnancy or, you know, early, like first foods. So, you know, thinking about, you know, capturing that segment of the population who, and I think WIC is a wonderful, you know, another example of how WIC could be, you know, really, really instrumental here to, you know, and be introducing, you know, first foods and doing like, you know, healthy baby food recipes and things like that with, you know, food bucks for the carrots, and then you learn how to puree the carrots and do taste tests and things like that. I think that could be really an innovative way of doing it, and I actually haven't heard that being done anywhere. So that's just, you know, it seems to me to be a wonderful next step for maybe one of you to do a pilot on that. I think there's also, the other piece is you know, at farmers markets, of course, so understanding, you know, that it may be a corner store initiative or a convenience store type of project, but, you know, also to think about the farmers markets and how to integrate them. And so that's, you know, kind of that concept. The other direction is sort of what happens in the hospital. And, you know, clearly there's kind of looking at institutional purchasing and things like that. You know, ways to make the food served in the hospital to hospital employees healthier, and certainly to patients. Doing things
Karen,
like—
that's actually a good point you're bringing up, because there are several people who are working on procurement in hospital systems, so this information would be very helpful for them.
Yeah, excellent. So, right, so we, you know, certainly look at farm to institution is one of the, you know, types of, you know, support that we lend. So looking at, you know, procurement in terms of, you know, hospitals employ, especially in rural areas, hospitals are often the largest employer. And, you know, they employ thousands of people. And so thinking about how to make the food healthier for employees, looking at doing things like a CSA, you know, drop-off or, you know, pick-up at the hospital. The giant parking lots are often quite appealing for use as a farmer's market, for example. And, you know, and again, even if it's a farmer's market in the hospital itself that's used for employees and patients and their family, or not patients, of course, but they're, you know, visitors, I should say. And so there's those types of ideas, and I think, and I love those ideas, and they're good ideas, but again, I think there's other ways of really integrating the work as well that are newer, although I think that's all new as well. But, and I'm talking about fruit and vegetable prescriptions, so in other words, integrating with retail. I mean, those are things that are focused on the hospital, I should say, and helping improve the food and beverage environment of the hospital, but they don't have to do with retail. I guess that's a better way of saying it. The ways of integrating the hospital with retail, but in the hospital, are looking at things like, you know, how retail, or I should say food access in general, how is hunger being screened in the emergency room? Are people being told where they can get healthy food? Could the hospital support a health bucks program, which we've started piloting here in Philadelphia, where, for example, a diagnosis-linked, you know, patients, a low-income patient, or a patient on WIC, for example, who comes into the hospital and gets a diagnosis of gestational diabetes, and that's a trigger for that patient to get health bucks, where they, you know, are you know, food coupons given out by the hospital to qualifying patients for fruits and vegetables with a map of where they can buy fresh fruits and vegetables in their community. And, you know, the hospital can then help to create some of that demand to really help bolster these programs and connect their patients with the, you know, new healthy food and beverage environment. So doing fruit and vegetable prescriptions, doing health bucks, thinking about the fact that, you know, many physicians don't really get formal training in human nutrition, and beyond that, even don't have, you know, training about food security and food access challenges, and really sort of the impact of SNAP or WIC, for example, on their patients, or the impact of low food access on their patients. And so even thinking about, like, how can you do, like, a grand rounds, for example, or how could you do a training with the employees so that everyone is kind of well-versed with these concepts. Everyone knows what, you know, checking for, you know, are you on WIC? Are you on SNAP? You know, helping to support enrollment for these programs. And, you know, a lot of, certainly, that has, supporting enrollment is important, but sort of thinking about making it more comprehensive, including locations and, incentive strategies and so on, are just some examples of ways that this work is being done now, or the way that, certainly some new ideas, for example, the kind of mother-baby and prenatal ideas that I shared.
Karen, thank you for an overview of some of the ideas related to involving hospital systems in the clinical and community linkages piece. It is surprising to hear that 8 years is the longest for a program like the one in Philadelphia. It's also impressive to hear about how robust this program is and that you guys are looking to expand locations. What other locations are you considering for expansion of the pilot?
Sure. So I'm hearing your question isn't where have we expanded healthy convenience store work, but is where are we expanding the community clinical linkages pilot?
No. You said that you have you started the program and there's a pilot, but you were looking for, is the expansion for different locations, or is the expansion in the types of services or partners?
Sure. So just to answer your question broadly, so just in terms of looking at the healthy corner store work, focusing on improving the food and beverage environments at convenience stores, that's work that has really expanded quite a bit throughout the country, and that where we're doing direct implementation in statewide initiatives as well as city initiatives around the country at this point. But the community clinical linkages work, which is brand new, I mean, a couple of years old, and it started as a pilot, as I mentioned, is being expanded into more stores, and also we are doing more things. So we're both taking the Heart Smarts program that we piloted and expanding that, so doing that in more than half a dozen or maybe 10 at most stores. And actually, expanding the number of stores where we're going to be doing that pilot over the coming year. And then also doing more collaborations with hospitals along the lines, particularly in looking at working within the hospital itself in the way sort of that I talked about in kind of the second category of, thinking about collaborating with hospitals and looking at their own internal processes and knowledge about these issues, and how the hospital itself can help support healthy food retail through things like health bucks and so on.
Okay. So if there are any questions for Karen or Juan, I'd like to remind participants that they could either raise their hand or put their question in the chat box, and we'll address those. On the line today with us is Karen Shore and Juan Vila, both from the Food Trust. To switch gears a little bit, Juan, let's hear from you about your work in San Jose. It sounded like you started out working on the Philadelphia Healthy Corner Store Initiative and helped with the conversion of some of the stores there. But some of your work today is more in San Jose for the past 2 years. Can you talk a little bit about that?
Yeah, absolutely. So I moved out here to the Bay Area about 2 years ago to work on a new project. It's a pilot program that was started in San Jose. So the overarching program is called Good to Go. There's a focus on sort of fun, fast, fresh, convenience, grab-and-go foods. So I'm really focusing on items that are really convenient, that people can grab on the go, sort of quickly in corner stores, since they've identified that that's really where most people go for a bag of chips or a soda or something like that. So kind of counteracting that with items that are packaged in fun ways but that are also healthy. So it's really interesting. There's actually no health message in this program. All of the marketing is really focused around, making these healthy foods appealing and, something that customers want to buy instead of really focusing on the health message. So, as I mentioned, the tagline is fun, fast, fresh. We really look for products that are packaged in ways that kids find appealing, so sort of, using the Doritos marketing per se for, a bag of carrots or something like that. And right now we're actually in the process of implementing the project now. So we started consulting, and then a couple of years in, we sort of moved more into an implementation role. So pretty soon we'll be really widespread implementing throughout the city, looking at new stores and sort of expanding the pilot program.
Okay, thank you, Juan. Follow-up question for that. You mentioned that the focus is more on grab-and-go foods as opposed to maybe a fresh fruits and vegetables type stand. Is that based on what the store was already providing, or is it based more on the demographic of who you were trying to reach with the program?
Mostly on the demographic of who we're trying to reach. So there is still a good amount of focus on fruits and vegetables, and also like prepared fruits and vegetables, like fruit cups and things like that. But mostly it was sort of some market research and looking at what people buy when they're in the stores and sort of what kinds of messages work whenever you're trying to do an intervention. So there's this really great marketing firm that was contracted called Salter Mitchell, and they did a lot of research into how people respond to health messages versus sort of playing to their to the appealing how appealing products are and things like that. So that's sort of why the funders here decided to move in the direction of really making these foods appealing to customers versus focusing on the health message.
Okay. Thank you.
Yeah, no problem. Yeah, and I'll just add that, so we usually take our model to other cities that we work in and then really customize it and adapt it to whatever the needs are of that particular city. So, there's the kind of standard model that we've developed in Philadelphia, but then every place that we go with it sort of has its own very individual needs and, sort of different demographics of people and different types of store owners. So really it's a very adaptable model.
So Juan, if you're thinking of some of the lessons that you pulled from Philadelphia that you were able to use in San Juan in terms of marketing and reaching stores who are willing to participate in the program, what were some of the top best practices or top lessons that you learned from Philadelphia that you were able to apply in San Juan? San Jose, I'm sorry.
Yeah. No problem. I would say, just overall across any program that I've, worked on or helped work with, the most valuable thing is just really developing a strong relationship with the store owner and making sure that the store owner really knows what's going on and is really an active participant in the program. So, it doesn't really matter how the program is formed or what the, what the overall sort of strategy is. The store owner's buy-in is really the most crucial thing. So developing that strong relationship, really addressing their needs and their concerns and making sure that they feel like they're supported basically by project staff. So, really looking at sustainability of the program and making sure that store owners have an equal commitment to the project staff that's going into the stores, I think is definitely one of the biggest lessons learned and best practices that I've tried to implement across any consulting project.
And Juan, how do you typically get that type of feedback from store owners? Is it collectively as a group, or do you typically schedule meetings periodically with the store owners that are participating in the program, or is there some sort of collective forum for them to share their concerns and meet others in the program?
So, we have had plans to bring store owners together. It's a little bit tricky with corner store owners just because they work very long hours and sometimes very, sort of different hours from one store to another. So actually getting them together as a collective is a little more complicated. I found really that just the individual conversation with store owners has been the best way to address those concerns. So really taking the time to visit the store frequently and have that conversation with the store owner and find out how things are going with them and really just developing that relationship individually.
Thank you.
That's no problem.
So we'll provide another opportunity for anyone who's on the line today to pose a question for Karen and Juan from the Food Trust today. Just a reminder that you can type your questions in the chat box. We're reaching the We're roughly 10 more minutes left in this call, so to be respectful of people's time, now would be a great time if you have any questions to go ahead and pose your questions now. We will ask Karen and Juan to address those. Okay, Nicolette, are you still there too?
Yes, I'm here.
Okay. Do you have any questions for Karen and Juan as we wrap up for today?
No, the question I did have, they actually answered in their presentation. So.
Okay, wonderful. Okay. Karen and Juan, I don't see any other questions at this time. Is there anything you'd like to say in summary to the attendees on today's call?
You know, I think the one thing that I would just say in terms of understanding this is, you know, we've certainly talked about some large initiatives today, and I do want to say that, you know, sort of starting small is the way we started, certainly, and it's the way that we, you know, frequently, you know, recommend getting started, both in terms of, you know, numbers of stores in an initial initiative, as well as what the ask is of the store from the beginning. So, you know, and kind of helping to start as you mean to go on, in other words, and cautioning against over-promising and under-delivering, which will, you know, create some problems both with the store, but also, of course, in the expectations of residents that have really long experience, you know, being promised things that and not, you know, having folks, you know, sort of be true to their word on that. And I also would just include kind of, even though the grant may be on something very specific, thinking about what the broader vision is for the community. So now I'm going to sound like I'm contradicting myself, but I promise I'm not. So even though if you're working on a grant, for example, that may have, you know, you may have 3 stores in your community, you know, depending on where you are. You may have 10 that you want to work in. But thinking about what is the broader vision for the community in terms of what the stores will be and kind of what they will do to residents in the community and how that will, you know, really promote a culture of health in the community, I think is really important. So even if you don't have funding or partners on board right now to do community clinical linkages, for example, you know, then, you know, kind of, but designing that in the beginning to think about kind of where you're heading. And I think it can be very powerful to, you know, take the time now to get feedback, as many of you have already done, from the residents in terms of what their needs are from even a broader perspective, as well as, you know, stakeholder input for kind of what the vision could be.
Okay, thank you, Karen, for that summary. I do think it's important that you kind of talked a little bit about promoting a culture of health beyond the scope of the project, which is something that I think is in the back of a lot of people's minds, as they have such a short amount of time to accomplish the work that they are doing for this particular initiative. But beyond that, obviously people want to see improvements in their community overall that impact people's health, particularly in places where they live, work, and play. So thank you both for being on today's call and for sharing your experiences as they relate to projects in both Philadelphia and also San Jose. We appreciate your time this afternoon, and thank you for being on today's call.
Thank you so much for inviting us, and you know, really hope to hear the progress in the various regions that you all are representing.
Yeah, thank you very much, Cheryl. It was our pleasure to talk with you guys today.
Okay. So we will go ahead and conclude today's call for everyone. Thank you for participating.
Thank you.
Thanks. Bye.
Bye.
Okay, bye, everyone.